I believe we are.
Okay. So Andrea can see us, so we are live. Hi, everybody.
Give another couple minutes, maybe a minute or two past the hour, Dr. Chung, and then we'll jump in.
Sounds good.
All right, we'll give it just a couple more seconds, let a couple people jump in. I see the numbers still going up. Well, welcome everyone and good evening. Thank you for joining us for our webinar. We are VMAP, the Virginia Mental Health Access Program. And this webinar is about pediatric mental health and primary care. We're going to talk with you a little bit more about VMAP as part of this webinar. I am the program director for VMAP, and I have Dr. Sandy Chung here, who is VMAP's medical director. I am also going to just briefly introduce her, and then I'm going to hand it over to her for us to get started. So this is Dr. Sandy Chung. She is the CEO of Trusted Doctors, a pediatric group with over 122 providers in 22 locations in Northern Virginia and Maryland, and CEO of Health Connect IPA, which is a primary care clinical integrated network that has over 200 providers in Northern Virginia. She has over 20 years of pediatric experience, is active in multiple state and national organizations, with a strong focus on mental health advocacy and health information technology. In addition to being the medical director for VMAP, she's also the medical director of informatics for the Pediatric Health Network, member of the Connect Virginia Governing Board, and member of the Virginia Early Childhood Foundation Board. She's immediate past president of the Virginia chapter of the American Academy of Pediatrics, past chair of the board for the Virginia Foundation for Healthy Youth, and past president of the Medical Society of Northern Virginia. Excuse me. She's associate professor at Virginia Commonwealth University Health Sciences and associate professor at Georgetown University School of Medicine. She has 4 amazing children, and her interests include health information technology, health policy, expanding access to pediatric mental health care, practice management, and advocacy for children and pediatricians. Welcome, Dr. Chung.
Great. Thank you, Ellie. Thank you for the great introduction, very long one, my apologies. And thank you all for spending some time with me this evening. I don't expect this to take the full hour, but hopefully you'll find it informative and you'll learn something about what you may be encountering every day in your practice, as we are, as far as issues with mental health in our pediatric patients. And so let me start with the disclosure slide. This was approved for credit, so there will be at the end a way to get credit. You'll need to answer some questions through a survey that we put out as a requirement by the Virginia Nurses Association, so that we can issue you the continuing education credit. So please stick around for the end so that you can get that. And I don't have any conflicts to disclose. These are my 4 kids, and so when they were a bit younger, they were a handful for sure. And I think the reason why I include this slide is that we know that with mental health conditions that they can present very early in a child's life, and so it really, from the beginning, there's a growing school of knowledge regarding mental health, even down to infancy. And so when we think about mental health, and we obviously know there are issues going on with the pandemic, we really need to look at all children at all ages and consider the impact on them as they grow. So let's talk about the problem nationally. So we know that 1 in 5 children, actually more than 1 in 5 children, have a mental health condition that's diagnosable. And 44% of these children presented by the time they were 11, and half of all mental health presents by age 14, and even 3/4 present by the time they're age 24. So very much, if you treat children or see children, we are seeing symptoms of mental health early in their lives. And we also know that people go to their primary care providers first. You know, they'll go for preventative care, they'll go for sick visits. And so often we will see the symptoms of mental health disease long before anyone else and long before a diagnosis. So it's really something that very much affects pediatrics and family medicine. How about in Virginia? So according to the State of Mental Health in America 2021 report, over 14% of Virginia's children have already had at least one major depressive episode. And of those children, only half got care. And then those who got care, only 26% got consistent care. So we're not doing a great job with seeing these kids and providing them the treatment, but there are reasons for that. There are certainly several issues in play. Also, we know that suicide is the second leading cause of death for children ages 10 to 24. And the Virginia Foundation for Healthy Youth and the Virginia Department of Health do a survey every 2 years of middle and high schoolers in Virginia. And the last survey we did in 2019 showed that 1 in 4 girls and 1 in 8 boys have seriously thought about committing suicide in the last year. 1 in 3 of our high schoolers from that same survey indicated that for more than 2 weeks, they felt sad or hopeless. And then in the past year, 12% of our high schoolers and 14% of our middle schoolers have even gone so far as to create a plan. There's a shortage in Virginia of mental health providers, and we're going to talk more about that. But 64% of Virginia's localities don't have enough providers, with only 13 child and adolescent psychiatrists for every 100,000 children we have. Yet over 65% of pediatricians surveyed nationally said that they can't manage this on their own. And then you add the pandemic. We have seen many surveys and studies at this point showing that the children and young people are disproportionately impacted regarding mental health because of this pandemic. Mental Health America does a survey monthly of individuals across the country. And when they looked at surveys that they did with adolescents, so 11 to 17-year-olds who already had a diagnosis, a pre-existing condition of anxiety and depression, they had an exacerbation. And the question that was posed is, what's contributing to your exacerbation of your anxiety or depression right now? And this was when the pandemic was starting, so in April and May. And you can see very clearly that loneliness and isolation which we know at this age group that peer-to-peer interaction is so essential for normal healthy development, that lacking that during this critical time frame has impacted the mental health of our young people. We, as the Virginia chapter, the AAP, we surveyed pediatricians and pediatric providers in our state. And when we did that, we asked them, have you seen more mental health issues? And the question was, the answer was a resounding yes. So 88% reported that they've seen more mental health conditions. On the graph on the right, you can see which conditions were primarily mentioned. So no surprise, anxiety, depression, other behavioral issues. Yet 62% said that they could not meet the demand or the needs. Nationally, the Mental Health in America also does a survey. And here you can see what you're looking at is the red line are the number of kids who screened positive for anxiety. When you look at the kids who screened positive for anxiety, the bar graph indicates how many of those kids screened positive for moderate to severe anxiety. So you can see of the kids who are screening positive for anxiety, it's not mild anxiety, it's moderate to severe for the most part. And almost identically, depression was the same thing. So you can certainly see with the red line, the number of kids that screened positive for depression increased month over month over the beginning of that pandemic. And this has continued going forward. And of the people who screened, the young people who screened positive for depression, 90% were screening positive for moderate to severe depression. We also saw an increase of suicidality. So on the bottom left, this graph, the red line's a little bit different. What it's showing here are the number of people, adults and children, who indicated that they had suicidality. The bar graph is the percent of those people who indicated that they've thought about suicide or self-harm that are 11 to 17-year-olds. So you can see almost half of the people who are thinking about committing suicide are young people. And on the right, you can see that over year graphs compared to previous years, there's clearly been an increase in 2020. We also know it's disproportionate as far as specific groups. So LGBTQ plus kids have been reporting higher rates of suicidality. And then Asian Pacific Islanders actually have been looking for mental health support more frequently than before compared to previous years. And Black or African Americans have had a highest increase in percent change over time with anxiety and depression. And Native Americans and American Indians have had the highest average percent change for suicidal ideation. So all of these numbers are, are not surprising. It's unfortunate that we're seeing this. The emergency rooms have also been reporting an increase. Some of my colleagues, I had a pediatric emergency room director recently reach out to me because her emergency room is serving as a boarding facility as children with mental health crises are waiting for psychiatric beds. So that while over the pandemic, we know visit volume dropped in the beginning, we know with the absence of viruses back then, that's obviously changed now, but we weren't seeing as many kids in our facilities. They weren't coming through our offices, they weren't coming through the ERs. However, those kids who are coming for mental health reasons continue to come. So the proportion of ER visits for mental health related illness went up during that time frame. So why? We certainly know that loneliness, isolation has added to the exacerbation of this. We also know certain kids are more susceptible. We talked about different races and ethnicities and groups that may be more disproportionately impacted. There are other things too that kids have, excuse me, that also make them more vulnerable to mental health conditions. And that includes their age, educational status, if they have pre-existing health conditions, special needs, if they're economically underprivileged, if they've been quarantined, all of these things that we really need to recognize have added to the exacerbation. School is obviously of concern in this age group as well. So when we think about school, most schools, if not all schools, are going back in person. If they haven't already, some have already started and some are starting in the next couple of weeks. So as they make that transition, there's a fair amount of anxiety that is happening, depression, maybe change in their patterns that's causing trouble at home, or behavior issues or concerns, disruption to normal schedules. So back when I first started giving this talk, that disruption to normal was going from in-person to virtual. Well, now it's the other way. Virtual became the norm, and now we're having kids go back to in-person. So that disruption, as we all know, schedules and consistent schedules, how many times have you told, a parent of a child to try to keep, their schedules consistent, whether we're talking about sleep or we're talking about potty training or whatever we're counseling a family on, children thrive on routines. And so changing routines by itself is going to be an impact on kids. And we know they've missed milestones. And so maybe we bring some of those back or maybe not. We really will have to see how this fall goes. The changing learning schedules. Recent studies have shown that many of our children, because they were in virtual school last year or hybrid, they've actually missed several months of learning. And so as we start the fall, I think for education purposes, there's quite a bit of focus on where are these kids today. I've seen estimates of 3 to 5 months behind where they should typically be in the fall. And so because they didn't learn nearly as much last year. We also know that many kids actually didn't even participate in school last year. There are a fair number of thousands of children actually who were truant because of virtual learning. Either they couldn't because they didn't have access to internet, or if they were having access, they weren't engaged as they normally would be. And so really that digital divide was an impact, and we've certainly heard lots about, improving infrastructure and trying to increase internet access. But certainly we all have families who we know had multiple children in school, but perhaps they only had one device that the children could use to log into class, or perhaps they didn't have internet that was fast enough to do video learning. And so again, trying to close those disparities over time will be important. But because of that, we have kids that are going to go back into school in the fall or now really, and be in totally different places based on how last year went. The good news, though, about having school in person again is that now some kids can get access to mental health services. Actually, about 13% of teenagers actually get their mental health services in school. And then 35% of those kids actually get all of their mental health services in school. Last year, there were efforts to do this virtually, but now that we're going back in person, the hope is that now these kids can once again access counseling resources and the mental health resources that they had, and that should help. We have a fair number of kids, this was before the pandemic, about 8.4% of kids had an IEP that was based on an emotional issue. Now, as we're thinking about mental health in our practices and how to resolve that or how to help people with that, one of the areas that we should focus on, if we are able to, is social determinants of health. And I did hear from a colleague of mine who said, I wish they wouldn't call it social determinants of health because it sounds so final, that your social status determines your health. And he wanted to change it to social barriers for health. And it's really, however you wish to call it, the concept's the same in that, there are things in play that are outside of school and outside of the doctor's office or the nurse practitioner's office, where we can say, we can prescribe and recommend all sorts of things, but if they go home and they don't have access to food, that's going to be first priority, or if they don't have housing, right? And so one thing that is available to you is Bridges to Resources Virginia. So in this bottom left, you can see Bridges to Resources Virginia. It's a website. You can just log on to it, or you can go to the VMAP website and there's a link to it. And what this is basically something that you can give to your patients. So if you determine that let's say you do a social determinants of health screening, If you screen for food insecurity or housing or transportation insecurity, you can actually give this to your patients. They type in their zip code, and when they type in their zip code, it will provide them a list of resources in various sectors. So maybe for transportation, for housing, for finances, for childcare, for mental health. There's really a tremendous database of resources there for the patient to have access to. So please try to use that, and it is free. It's available online. And so Bridges to Resources Virginia. And there's the website. But like I said, it's on the VMAP website. It's on our Virginia chapter, the AAP website as well. So I mentioned that we didn't have enough providers. We don't have enough mental health providers in our communities, and that should come as no surprise to anyone on this call. We actually ranked 41st lowest in the country for this, for the number of child psychiatrists and therapists for children in the country. We rank very poorly. Only 2 counties as of 2019 had enough child psychiatrists for the number of children in their region. And you may have seen this map. This is from the American Academy of Child and Adolescent Psychiatrists. So in this map, you can see 2 counties that are green. Those counties have enough child psychiatrists for the number of children in their county. The yellow counties have a shortage. The red counties have a severe shortage. The gray counties do not have a child psychiatrist at all. So we can see why there's an issue. And this is a national issue. There are not enough child psychiatrists for the number of children that need help. So what do we do? Well, we did ask our pediatricians, again, our poor pediatricians have been surveyed so frequently, and our pediatric providers. So if you answered one of our surveys, thank you so much. And so we did ask, in Virginia, are there enough child psychiatrists? Is there enough access? And 98% said no. And then we asked, is there adequate access to child mental health providers? And 91% said no. And then asked again, are you able to handle this? 85% said no. And then we asked, can you talk to a child psychiatrist if you need help? 95% said no. And so, as you know, in healthcare, if you wanted to pick up the phone and talk to a cardiologist, for example, most of the times you can get one on the phone. Like you can get them on the phone right now, or during the day, and they would either talk to you or help you, or maybe even see the patient that same day or the next day, depending on what was going on, or just advise you. However, with child psychiatry, that's not true. Some areas are lucky enough to have that, but most areas of our state, that's not possible. So what do we do? So VMAP is a possible solution here. It's a resource that's available to you. What is this? So there are actually several programs like this across the country. They're all a little bit different, but the concept's the same. And you can see in different states, they're at different stages of development. The blue states have more mature programs, and our state's yellow. So we're working on our program. We're no longer a startup, but we're still growing and expanding our services. So there's 4 parts to VMAP. So one is education, and that's education for us. So as providers, learning how to better manage anxiety, depression, ADHD, bipolar disease, autism, all these things that we may or may not have had enough training when we went through our training, it's available to you. And we'll talk more about what programs we have offered. Consultation. So remember how I mentioned, if you wanted to talk to a cardiologist, you could just pick up the phone. Well, now you can do that and talk to a child psychiatrist too, through VMAP. And care navigation. Care navigation is where you would pick up the phone and call VMAP and say, perhaps you have a 12-year-old with anxiety who needs a therapist in, Cumberland County, and maybe they have Medicaid, or maybe they have no insurance, or maybe they have commercial insurance. And then the care navigator would actually reach out to the family and help them find care. And then telehealth is not yet developed, but the concept with telehealth, we're all very used to telehealth now, but this is a little different. What the telehealth services here are for is if you call VMAP, and you speak to the child psychiatrist, and they just need more information from the family to help guide you on what to do, then we may set up a telehealth visit so that that child psychiatrist or licensed mental health provider can get more information directly from the family and then get back to you to say, this is what you should do, So it's not quite long-term telehealth for treatments, but rather to augment the consults. We divided the state into 5 regions, and you can see them here. And the stars are where our hubs are. And the hubs are where the child psychiatrist, the licensed mental health provider, and the care navigators reside, where they're working from. When you call us, you don't need to necessarily know what region you're in. We can figure that out for you. So here's the flow again. So basically, we start with education. If you need assistance with the patient, you call VMAP. There's a call center that'll do an intake, and they're going to ask you various questions about the patient. So it is better if you are actually the one talking to the call center, not a nurse or a front desk staff. You would want somebody who's clinical to be talking to them because they're going to ask some clinical questions. And then based on the call, it will determine whether or not we connect you to a child psychiatrist or a psychologist, a social worker, or care navigator. So we've been running for about 2 years now. And we're continuing to grow. So when we first started, it was very limited in where we could service, but now we're statewide. So far we have supported about 29% of our children that we've served through our phone calls. We're in Medicaid. 34% were identified as youth of color. And you can see many have private insurance, and we have different ethnicities represented. I mentioned the education, and so hopefully you've heard of some of these, but if you haven't, they're fantastic opportunities. The REACH program is a more concentrated program where basically you spend a weekend learning about how to manage mental health conditions in kids. And then afterwards, there's phone calls, like case study phone calls that happen every other week, I believe, until for a few months. And so we are enrolling now. It's really amazing. It's for many people, it's one of the best CMEs they've ever done, including myself. So I highly recommend it. It is all virtual now, so it is easier to attend if you can. And hopefully one day we'll get back to in person, but for now it's all virtual. Project Echo, if you tend to learn better in small bits, or you don't have as much time, Project Echo is a great way to learn. So Project Echo is once a month, basically, typically over a lunch hour, you can see there. And the way that works is essentially the first 20 minutes or so, you learn something. So there's a speaker or specialist there speaking about a topic. And then the second half of the phone call is where you're sharing cases. So it's sort of real-time learning, and you can bring up patients that you're dealing with and get help. And so it's a really great way to learn real time. And so we run these, even though they say, Northern Virginia or Eastern or Western, that's sort of a general concept. Since they are virtual, we can mix and match a little, but we do try to keep it a little bit regional if we can. All the ones listed there are full, but we continue to offer more. So if you go to our website, the vmap.org, you can see which programs are open. So we're continuously adding these. We run about 6 to 8 of these per year, both the REACH Institute and the Project Echoes. We run several of them throughout the year. On the right, you can see if you need MOC credits or CME credits, we also do quality improvement projects. And so right now, the one that we're doing is where we're implementing a tool called the SEEK tool. And that includes social determinants of health. It looks at a little bit of trauma, and it looks at mental health as well. This is just an example of results from one of our QI projects. So on the left, you can see we implemented screening. In this case, we were implementing mental health screening, such as PSC-17 and some of the others. And then on the right, we were also implementing screening for depression, so maybe PHQ-9 or PHQ-2. And you can see nice improvement over the time frame that we did the project. So we do ask that you register to use VMAP. It's not, there's no cost to it, it's free to you, but we do want to track who's registered. This also helps us for funding purposes so that we can continue to get funding for the program from the state. They do ask, what do we accomplish with the state money? So we want to be able to show that we're doing good work. And so we do ask that you register. So far we have 545 PCPs registered. We've done over 1,000 phone calls, and we've done many, many trainings with hundreds of people trained so far. there are a lot of people involved in this process, lots of different agencies you can see. So several state agencies, we have several institutions and organizations that are all working on this. And really while we are the executive committee, there are just lots and lots of people working on it day to day. They're in these work groups. We have lots of volunteers as well. So if there's something that interests you with VMAP or you have a particular interest, we'd love your help. So we have an education work group. We have a consult work group, care navigation, telehealth. We have a quality improvement and data work group. And then we have an equity work group as well. When we first began, we had just Northern and Eastern Virginia covered, but now we're so excited to say we have all 5 regions represented. So we have hubs all across our state. So we are continuing to expand the education, the regional hubs. Again, we have them. We've hired everyone pretty much now at this point. And so everyone's onboarding. So, but you can call today. We have actually several hubs that have been functioning for a while now and over a year, and they can answer calls from all over the state. There's also a project called Unite Virginia, which is going to help us with finding resources so that when you think about the care navigators and they're building up a database, the question is, well, where are these people that are going to be in the database? And this program called Unite Virginia is a statewide effort to build that up and to build up that information. And several groups are working together on that. So here's the phone number, and you can actually just go online and find it as well. One thing is that so we're open from 9 to 5, Monday through Friday. You can actually ask for a callback online as well. You're not putting in patient information when you do that. You're just telling us you need a callback, because sometimes you may not, get to this between 9 to 5, right? And so if you're thinking about it in the evening or finishing up your chart notes and you're like, oh, I really need to talk to someone from VMAP about this, then you can just go online and request a callback and we'll reach out to you. We do serve patients up to 21, so 21 and younger. So your older children, we are not able to service them. I guess they're young adults at that point, but we can't service those patients just yet. But 21 and under. And the patients need to live in Virginia because this is state funded, so we do need them to live in Virginia. There are many partners here. I really just wanted to give credit to so many people who have helped make VMAP possible. I did want to show you a quick video to give you an idea of what VMAP has been like for people who've used it. So hopefully this will play and hopefully you can hear.
So I actually used the consult line just last week. And, while the REACH training and, my 12 years in primary care pediatrics as a physician have given me a lot of tools, I had a patient who I was just over my head. And before the consult line would have been available to me, I would have had to send this child to the ER. So to let you know a little bit about this kid and family, this is a child who's been in and out of the psychiatric hospitals 6 times in the last 2 years. Most recently, I am in Roanoke, Virginia. He was admitted to a hospital at Virginia Beach. So 3 weeks ago, this child was discharged to home from Virginia Beach. Their first psychiatrist appointment, because they don't have a local one, he's been in the hospital so much, isn't until 2 weeks from today. He was on 5 medications and hallucinating. He was safe at home, wasn't suicidal, so did not have a reason to be admitted to the hospital again. I was able to call the consult line within an hour, talk to a psychiatrist, and I had a treatment plan. And I called the kid's mom back. She was on her way home because she lives an hour from me in a rural area of the state. And we established a treatment plan, and I'm going to see them back later this week. And that is care that I could not have provided without the consult line. I would have been over my head. I wouldn't have known what to do. So think about, what is VMAP doing for us in primary care? There is a real burnout that can I've seen happen, I see happen with my colleagues in primary care, where we feel like we know we need to address a need and we may not know how to.
I've been so thankful that VMAP has been there doing the consultation lines. They are responsive very quickly. I get phenomenal advice. I am much more comfortable. I feel like my patients get so much better care by getting advice from VMAP than if I had referred them to a general psychiatrist, somewhere within an hour from here. And I feel my patients are much better cared for. And when I need to get help and do a referral, I still have trouble finding somebody to do a referral with, but I feel like the patient's under good management until that can happen.
Especially when it comes to any need for medication, there is just such a long wait, issues with insurance and so on. And so I just felt like my hands were tied. And now, with VMAP, I feel like I have been able to bridge that gap. And that, has been really, really meaningful. Being able to have, more of an education and background in how to manage these medications. And then when we are limited still in our knowledge set, to be able to call the psychiatrist and get, that feedback to intervene has been just a huge, huge lifeline to basically bridge that gap. These families would be just waiting for months and months without any help otherwise.
But luckily, the VMAP program was there. One of the prongs of the VMAP program is education. And through the education prong, I've been learning a lot about how to screen for depression and anxiety in adolescents and how to manage it and treat it.
I remember my very first mental health patient that I took care of when I was attending. And this patient came to me in a checkup and she was severely depressed, getting to the point of being suicidal. And I knew that I needed to do something now to help her. So I walked out of the room and went over to one of my colleagues who I know does a lot of mental health and has prescribed a lot of medication, and I said, I need help. And they handed me all of these different tools that I could give this patient, walked me through some basics about how to start the medication. And I did all of those things and I felt, wow, like I think it just really helped this patient and made a big difference. I don't feel comfortable doing this at all on my own, but it's here and I'm going to have to do this. I'm going to take care of my patients. So I was very fortunate to be given the opportunity to participate in the REACH conference within a few months of being an attending. And it was offered free of charge for many of the people that are in my local community. Several people from the practice where I was working, we all went together, and it was the most impactful CME course I have ever had. I walked out of those 3 days and transformed my entire practice. I started screening more readily for mental health concerns at every single checkup. I felt more comfortable evaluating patients and diagnosing them with things outside of just ADHD, but really getting into more anxiety and depression. I started doing a lot more medication, getting a lot more comfortable with all of that. And now I can definitely say that mental health is a very large part of my practice. And I see patients every day, treat patients every day, and VMAP has been extra helpful at this point because I feel quite comfortable with a lot of the straightforward issues. But then when it gets a little bit more complicated, it's amazing to be able to pick up the phone and get into contact with a psychiatrist and get advice that then I can use not only for that patient, but for when I move forward and take care of other patients.
About a year and a half ago, I did my first conference with our Project Echo, a year long. group. And so I just completed that, I want to say August of this year. And after that, immediately signed up to do the deeper dive for the younger kids between 0 and 5. And then was connected to the REACH conference as well, which myself and one of the physicians at our practice just completed. And so I feel like I've learned a ton. I feel like my skills have grown because of that. It was great to hear from not only psychiatrists, but also from pediatricians. I feel that my understanding of a lot of these conditions, ranging from depression to bipolar disorder, has grown. And I know that my comfort level with more complex conditions has grown. And then more recently, I've been able to also use the VMAP line for one of my patients that unfortunately is unable to follow through with psychiatry appointments. And so we have been managing his condition, and I feel like he's tried more medicines than any of my other patients. And I was able to reach out to psychiatrists through VMAP, and they called back in like 5 minutes and gave me some recommendations for what to do when he comes in next.
So hopefully that gives you some idea of the experience with VMAP and how it can benefit you in practice. Before we go, I wanted to touch base on a few things that you can try in practice with some of your patients. Cognitive behavioral therapy is a type of therapy that works extremely well in many patients, in particular those who have anxiety, especially, and then also with some kids who have depression, phobias, various disorders where the structure of how they're thinking about things might be contributing to their disease. So it's very problem-focused therapy. It's parents can help engage in this. The kids can learn how to manage, depending on their age, their way they're feeling and the way they're thinking about things. We also know that, medications alone are not the answer, and sometimes they're not necessary, but if they are necessary, you can't just prescribe medications and expect a mental health disorder to be treated. It needs to be done in conjunction with therapy. And studies have shown that cognitive behavioral therapy and SSRIs are more powerful than either one alone. So what is it? If you're not familiar with it, some of it are things that you know about, so relaxation and mindfulness, writing in journals, cognitive restructuring, we're going to talk about a little bit to understand what that is. Gradual exposure, that can work especially for phobias, where perhaps first you visualize the item that or the situation that makes you anxious, and then gradually perhaps you get exposed to it bit by bit, hopefully showing that nothing actually happens that you were worried about. Obviously it doesn't work for everything, but can be very helpful for many types of anxieties. Role play, and then experimenting to see if whatever you're worried about actually happens. Again, that's only appropriate for certain things. So what's cognitive restructuring? So I don't know if you've heard of this. It's called the cognitive triangle. And the idea is that our thoughts control our feelings, which also control our behavior. And vice versa. So our feelings impact our thoughts and our behavior impact our thoughts and feelings. And so one of the ways that we think about how to address anxiety or depression is, how do we stop those unwanted thoughts, the story that we keep telling ourselves that make us feel a certain way. Now, thought stopping, so first we want to stop thinking about it, but obviously just saying don't think about it doesn't actually work. If I say, let's all think about elephants, and stop thinking about elephants, don't think about elephants. You may still be thinking about elephants, even if you're trying to say stop thinking about elephants. What you want to be able to do is step 2, which is thought replacement, where instead, let's say, let's all think about a giraffe. Everybody think about a giraffe. And so now if you're thinking about the giraffe, it's very hard to also think about the elephant, unless of course they're in the room together. But the idea is that you want to replace the thought with another one. So here's an example of that process and what it looks like for perhaps a child, So what happened? What was the event? So my friend Emma hasn't spoken to me as much over the past week. Okay, so my friend hasn't talked to me over the last week. So this person is thinking, Emma hasn't talked to me much this week. She must be mad at me. And so this is the story that I've told myself, so I'm thinking, okay, Emma doesn't talk to me because she's mad at me. And so what do? Well, I'm upset that she's mad at me. So I ignore her and I'm going to avoid her. And then the way I feel sad and hurt because now my friend won't speak to me and I'm ignoring her. And so that is what's happening in my head. So then the exercise, and there are worksheets actually around this, but what you think about isn't always true, right? This is your guess or your assumption of what might have happened, but something different may have actually happened. So the exercise is to actually come up with different thoughts to have about that same situation. So a new thought might be, Emma's upset with me, but maybe not. I don't actually know. So now the new feeling is, I'm not sad and hurt about it, but I'm kind of concerned. Is she upset? Maybe, but I'm not as sad. I'm not hurt and so instead what I do is I ask her, are you mad at me? And so that's the alternative pathway. And the resulting feeling and behavior is very different because I'm thinking differently. Another thought, an alternate thought would be, Emma's probably been busy at school or something else. So I'm just disappointed that she hasn't talked to me, but I understand. And then I'll stay friends with Emma and I'll just say hi the next time I see her. So again, the way you feel is completely different based on what you're thinking actually happened. A third option, example here is maybe she's upset at something else and it's not related to me. And now I'm worried about her, I wonder what's going on with Emma. And I ask her, does she need help? So the concept is that you teach the child how to come up with alternate thoughts. Now, I will say in the beginning, it's actually quite difficult because especially depending on the developmental age, they're sure they know why something's happening. And so coming up with alternate thoughts can be a challenge. But if you work at it, it is exercise and it is something to actually try to do. The idea is if you do it enough, then automatically you start to think about alternate thoughts when you're in a situation. Here's a list of some resources for you as well, for patients or for yourselves, if you want to take a look at that. And hopefully the slide deck will be available to you. The worksheets where you can work on alternate thoughts is there for you as well. And then, for mindfulness, certainly for a lot of kids, using apps are the way to go. This is just one that I like, but there are several out there. So mostly it's finding one that the child likes. So these are available to you as well. And these are my kids now. Everybody's a little bit older. So thank you so much for spending your evening with us. Thank you for your attention. I know it's tough after a long day to listen to a talk, so thank you. Our email addresses are there if you need to reach out to us, so please feel free to do so. And I think we have a few minutes for questions if there are any. And if there aren't any, we appreciate your time tonight. I will, let me give you the information here. So we have it in the chat. You'll see a link to a survey. If you want to go ahead and click on that and answer the questions so that you can get credit for tonight, that would be great. Looks like there was one question that was asked, which I'll answer here. If you consult with VMAP via phone, how's the documentation handled? Yep. And so basically, when you're discussing with us, the care navigator or the call center will put things in our centralized database, which is under the Virginia Department of Health currently. And then you will actually receive it'll be de-identified when you receive it, but a copy of what advice was recommended, so that you also have something you can put into the patient's chart afterwards. Hopefully that answered your question.
Any other questions? Just a reminder, we do need you to click on the link in the chat and complete those questions if you want to get your continuing education credits. We're also going to send an email after this presentation that will have that link in it as well. So we do need to do that for us to be able to issue your certificate. Unless we have any questions, we just wanted to thank you for being here tonight. Thank you, Dr. Chung.
Absolutely. Thank you all again for listening. Really appreciate it.